welcome. My name is Shreya Shankar and I'm from the Department of Mental Health Education. And today we're honored to have with us Dr. Pratima Murthy, the Director of the National Institute of Mental Health and Neurosciences, NIMHANS, Bangalore. We're here today to mark World Suicide Prevention Day, and we're here with ma'am to engage in a crucial discussion about mental health and suicide prevention. So thank you ma'am for your valuable time, and we look forward to your insights for today.
Thank you, Shreya.
Yes ma'am. So to start off our discussion, this year's theme for World Suicide Prevention Day is changing the narrative around suicide. So what does this theme mean, and what can we do to more effectively implement this?
Yeah, traditionally, if you see the narrative around suicide, it's been steeped in stigma and discrimination. We've always looked at people who attempt suicide as being very weak. Because of this kind of stigma, people have not been coming forward to report either symptoms that have led them to feel suicidal or indeed to report suicidal symptoms. So I think that's very important, and the changing narrative is really to be more understanding and empathetic to people who harbor these kind of ideas because of helplessness and hopelessness. Make sure that they get the right kind of help so that they overcome this kind of a situation.
Absolutely, ma'am. And there has been growing concern around suicide as a public health crisis. So what does it also mean that this is such a significant concern?
So all over the world, suicide rates are increasing, and therefore the same kind of trends are something that we are observing in our own country. And the very tragic part of it is that young people in their prime of life are perhaps the most vulnerable. In India, we also know that young women are more vulnerable, and therefore it becomes very important, number one, for people to understand that suicide is not the only option or an appropriate option, that they can be helped so that they do not feel helpless and hopeless. And when they do feel that life is not worth living, it's very important for them to reach out and get help so that that situation changes. And that's another thing that people need to know, that at times when you feel helpless and hopeless, you should never feel that all the doors and windows are closed. If you reach out, you will find that you can overcome that situation and not feel suicidal anymore.
Absolutely, ma'am. I think you raised really important answers about prevention itself. So what role does NIMHANS play in the implementation of the National Suicide Prevention Strategy released by the Ministry of Health and Family Welfare?
Yeah. So one thing, of course, is the prevention of suicide. And we know that there are two things that need to be done. One is, of course, preventing access to means of attempting suicide. And the second is to make sure that there is awareness building, that there is actually help to be provided for people who might have attempted suicide, to restore their confidence and reduce the risk of reattempting suicide, all of which NIMHANS has been engaged in. We also train important key stakeholders in society to spread awareness about mental health promotion, dealing with mental distress, and therefore also being able to help people who are in this in this kind of difficult situation where they might feel that suicide is the way out. In addition, of course, there is also the Mental Health Care Act, which has decriminalized suicide, and that's another very important strategy to make sure that people who are in this space get help. One of the most important recent initiatives is the Telemanus initiatives, where a person just needs to call 14416. And many of the calls have been related to either individuals feeling very helpless and hopeless and suicidal, or family members or friends reporting such kind of concerns about somebody else. And it's amazing how many lives have been saved, so that people haven't taken that momentary decision in that kind of feeling of helplessness and have been helped to come out of it. So I think every suicide is potentially preventable, and we need to look at how to do that. Many of the suicidal attempts are related to sudden frustrations, to maybe loss of relationship, to financial difficulties, to family difficulties, to a low mood, to economic hardships. So I think it's important to recognize these and help people to overcome those difficulties. Of course, there are other government programs like Manodarpan, which is also a Government of India initiative. There are other helplines in addition to Telemanus, which also help people to be able to deal with this crisis.
Right, ma'am. Thank you for that answer. So with the launch of Telemanas, as you mentioned, we've seen an increase in help-seeking behavior, especially in a lot of rural populations. So I wonder, how can we increase awareness of these helplines and other mental health resources that exist?
Yeah. So I think everybody, particularly young people, need to be made aware. So public awareness, maybe through the radio, to television, through social media, through maybe hoardings on buses, railway stations, other public accesses, schools and colleges and other education institutions, workplaces. I think everybody must know 14416 so that you can actually reach out. But in addition to these more formal mechanisms, I think we have to be supportive of one another. So I would say the most important thing is to reach out, especially when you're distressed. They say a joy shared is a joy doubled, a sorrow shared is a sorrow halved. So when you're in distress, it's very important to reach out. It's important for other people also to be not judgmental, but to recognize that talking about it and getting help is a sign of strength and not a sign of weakness. And I think that's an important change in the narrative that we need to recognize.
Absolutely, ma'am. And additionally, while institutions like NIMHANS and other government bodies have been working tirelessly to increase accessibility to such resources, there still exists this stigma. So what can be done to also challenge or change the narrative of the stigma?
So I think one way to change the stigma is to actually talk more openly about risks of suicide, the kind of statistics around suicide, what preventive measures need to be taken. So one of the things that we've done, for example, through the mental health education, is to actually engage with people who have lost family members to suicide, to talk to people who might have tried to take their lives by suicide, but are so glad that they've recovered from it, so that they can be important messengers to others to say what helped them to get over it. The fact that hope and recovery from these kind of transitory times of distress is a very, very important message to give.
Right, ma'am. And it is truly an important message to disseminate as well. And while we've been discussing things a lot on a collective forum, what can also individuals do to recognize warning signs in themselves and others?
Yeah, so I think individuals need to really learn how to make sure they take care of their mental health. We take care of our physical health. In the same way, we need to take care of our mental health well. And the general principles are a good diet, good sleep, good exercise, good communication and support systems, avoiding drugs like alcohol and tobacco and other drugs of abuse, but most importantly, having a good social network. Also recognizing when somebody feels low for a long period of time, as I said, feels helpless, hopeless, withdrawing from the usual things that they enjoyed. Those are trigger signs to get help. Obviously, the moment they reach out and talk about it, there is a sense of relief. But if they get the right kind of what we call mental health first aid, which is a supportive, empathetic kind of approach and a linking up to somebody who can help, I think that's the most important steps to be taken. So remember, life is very, very important and precious, and that's something that we all must be aware of. Our lives are precious, your lives are precious. So all of us need to be in this space supporting one another, and remember that at any point in time, whether it's disappointment, frustration, a loss or failure, all of this can be overcome, provided you recognize that there will be some way out if you only reach out. So I'd say reach out, get help, learn to look after your mind so that these strengths help you during times of distress. But if ever you are in distress, don't hesitate to reach out. Very, very important.
Thank you for being here today with us, sharing your valuable time and insights. I wonder, do you have any key takeaways for our audience for today?
Thank you, Shreya. I think the World Suicide Prevention Day and the World Suicide Prevention Month tell us again that we need to rejoice in life and good living, and therefore I hope that we will be able to reduce those statistics, those alarming statistics, and at the end of the day, make our lives worth living every moment, and of course help one another to overcome times of difficulty and prevent any life from being lost from suicide.
Thank you, ma'am. I think those are very important takeaways, and thank you for being here for having this crucial discussion as well.
Thank you, Shreya.